I have paper towel to place my supplies. For my supplies, I have a medication vial, practice pad, gloves. I'll refer to these as alcohol swabs, a gauze pad. For a subcutaneous injection, I would select a 25 to 27 gauge, 3/8 to 5/8 inch needle, 1 to 3 ml syringe. Due to my supplies, I'll be using a 3 ml syringe, 25 gauge, 1 inch needle. I'll begin by verifying the 6 rights of medication administration, which are right patient, right medication, right dose, right route, right time, and documentation. I'll verify the medication orders in the MAR. The order reads heparin, 1,000 units, subcutaneous times 1 injection, or times 1 dose. The medication available on hand I have is heparin, 10,000 units per 10 ml per dose. I have the calculated dose written on my whiteboard. Nothing in the back. I'll calculate 10 ml over 10,000 units multiplied by 1,000 units over 1, totaling 1 ml. So for 1,000 units, I will administer 1 ml for 1 dose of heparin. I'll gather my supplies and go into the patient's room. Upon entering, I'll close the door to ensure patient privacy, place my supplies on a clean, dry, flat surface, and introduce myself to the patient. Hello, Mr. Smith. My name is Bessie. I'll be your nurse. May I see your wristband? Thank you. Can you please tell me your first and last name and your date of birth? Thank you. Now, Mr. Smith, do you have any known allergies, such as certain foods, medications, seasonal, anything like that? No? All right. Well, Mr. Smith, the provider has ordered you or prescribed you 1 dose of heparin. I'll be administering it in 1 ml subcutaneously. I'll review its action, uses, common side effects, and adverse effects. Now for adverse effects, they require immediate attention. So if you experience any of those symptoms, please report them immediately, okay? Heparin is an anticoagulant that is used to treat and prevent thrombotic events. It decreases the clotting ability in the blood and prevents clots from forming or worsening in blood vessels. How it works is that it enhances a specific protein in the body that inhibits clotting factors. Common side effects could be headache, mild nausea after injection, mild or prolonged bruising. Now, if any of those symptoms continue or worsen, please also report them immediately. Adverse effects could be bleeding, blood in urine or stool, hyperkalemia, and just so you're aware, you might feel a slight burning or stinging sensation when I administer the medication, okay? Do you have any questions? No? Okay. I'll perform hand hygiene and apply clean gloves. I'll select the correct syringe and needle. Again, I would use a 25 to 27 gauge, 3/8 to 5/8 inch needle, 1 to 3 ml syringe. I'll clean the top of the vial with an alcohol swab. Then with the syringe pointing up and the cap still on, I'll withdraw 1 ml of air. remove the cap, and inject the air into the vial. Now I'll invert the vial and withdraw 1 ml of medication. If I notice any air bubbles, I would tap the syringe to move the air bubbles to the top, gently push the plunger forward to remove any air bubbles, making sure that I maintain the correct dose in the syringe. Remove the needle from the vial. For the purpose of this video, I have tried multiple times withdrawing the medication to remove air bubbles. I'm not sure if it's the liquid, but I'll presume as if there are no air bubbles. Also, for the purpose of this video, because I'll be placing the syringe down, I'm going to recap the needle using the one-handed scoop method. The calculated dose equaled 1 ml. I have 1 ml in the syringe. It's hard to see. With this. Now I'll select a site. I'll select the abdominal injection site about 2 inches to the left or right of the umbilicus. I'll assess the skin for any signs of bruising, inflammation, edema, or signs of infection, and palpate for any masses or tenderness. If any of those were noted, I would select a different site. There are no signs of contraindication. This site is appropriate for use. Now I'll measure the correct size of the needle by grasping the skin fold at the site with my thumb and forefinger, measuring the fold from the top to the bottom, ensuring that the needle length is half the length of the fold, ensuring that the needle is half the length of the fold. It is. I'll now clean the site with an alcohol swab by placing it, by applying it on this in the center of the site, rotating outward in a circular direction for about 2 inches. Discard this. I'll allow it to completely air dry on its own. I will not blow on it or wave it dry, and I will not touch the site once cleaned. With my dominant hand, I'll hold the syringe like a dart, palm down. With my non-dominant hand, first I'll remove the cap. With my non-dominant hand, I'll pinch the skin. With my dominant hand, I'll quickly and firmly insert the needle at a 45 to 90 degree angle. release the skin with my non-dominant hand, stabilize the syringe with my non-dominant hand by grasping the lower end of the barrel, moving my dominant hand to the top of the end of the plunger, and slowly injecting the medication over several seconds. Once that's administered, I'll withdraw the needle and I'll immediately withdraw the needle and apply a gauze gently over the site. I will not massage the area, and I'll inspect it for any bleeding and apply a bandage if needed. No bandage is needed, there is no bleeding. I'll dispose of the needle and syringe in a sharps container. Discard this. Remove my gloves. Dispose. Perform hand hygiene, and document the procedure. Done.